Okay, thank you very much, Mark and Antonella. Weren't they wonderful? We're going to talk about skin damage assessment clinic now. And again, this is about prevention, risk assessment, and about creating awareness. And this is especially about creating awareness for people around the potential damage of UV rays. And it uses the twin image UV detect camera with UV reflectant photography and a black and white Polaroid regular lens UV filtered lens. What it does is it helps the patient visualize excess melanin production. And so the message the patient gets is that if there is excess melanin production, very dark spots on the face when we use this camera, that the skin has been exposed to pretty intense UV rays. And there could be potential skin damage down the road. So we find that the younger patients seem to be impacted by this. You know, we all think we're invincible at a younger age, and we think, oh, I don't know if I don't really need that sunscreen. It's, you know, it's fine. I got lots of years to live. But when patients and younger patients see this, they find out, oh, maybe it's time. So it's a motivating type of an exercise. There's different ways to look at this. The very dark spots, as I mentioned, are excess melanin production, but there can be white spots on the face, and that's a sign that the pigment cells have been destroyed by UV. And that, of course, increases risk. We have to keep an eye on those particular spots. It increases risk for skin cell cancers like squamous cell or basal cell carcinomas. And then there's the more evenly colored. We don't see patches per se, but there's just an even dark color. And that skin is actually the most protected. So we'll look at a couple of examples here. And I'm going to ask Mark and Ryan to come up now. And this is Ryan Keller, for those of you who don't know. And Mark's going to be the subject. And you'll notice that Ryan's going to, or Mark, usually it would be you that adjusts the tripod, so that the cup is comfortably under the chin. And then it's simply taking the picture and taking out the photo, and it very quickly, you can see the results. You see this particular individual here. This is not using the UV reflectant. This is using the UV reflectant. You see the dark spots that I was alluding to where melanin production has occurred. And this person here, too, with the darker spots. And then the whiter spots in between, which are not protected at all. So this guy's got some spots that show that he's been exposed, but some spots that are still at risk. So in terms of the education that you'll get, with this particular clinic, you'll get a lot of education about how to talk to patients about their risks in terms of skin assessment. We know that there's different types of skin. This will be part of the education and understanding that. And Ryan's going to pass around Mark's picture, and you'll see that Mark's got some issues here with being in the sun. Now, the one caveat here is that the lights in here are not the best for doing this, so we'd suggest not having lights coming directly down on the camera or coming from the rear. So, but you can see that there's definitely some work to be done here. But the message is, and I'm going to skip to the bottom here, we want to practice prevention. So the message to Mark is, you know, not that you're doomed to a life of wrinkled face and skin cancer. The message is that we need to be more careful because it could happen if you don't practice better sun protection. Some people will say tanning booths, I use a tanning booth, so that's safe. Well, that's not true. Tanning booths actually do use UVA, which is less dangerous than UVB. However, they use a lot more of the UVA. So it makes it just as dangerous as the sun. So people need to be made aware of that fallacy. And the picture using the UV filtered lens provides just a glimpse, as I mentioned, of what could happen. We're not going to panic the patient or anything like that. It's a wake-up call. And we'll send the patient away with some information about protection practices, and there'll be bullet points here, et cetera. And here's just some of the things that they can do to help protect themselves from the sun. So any questions about the skin damage assessment? It's later in the day, so we'll move on.